Okay, so today we're going to start off with the coxa, which actually gets divided into three regions. You have your ilium, which is this part right here and up. You have your pubis region, which is from here down. And then you have your ischium or ischium, however you want to pronounce it, which is from here to here. For your ilium, we're going to start off with your iliac fossa, which is this one right here. It's on the anterior version. And then on the posterior surface, you have your gluteal surface. Then you're going to have your iliac crest, which is at the very top. Then you have your anterior superior iliac spine, your anterior inferior iliac spine, and then your posterior part would be this one right here, which is your posterior superior iliac spine, your posterior inferior iliac spine. After this, we have the greater sciatic notch, which is right here, and your auricular surface, which as you can see kind of looks like a little peanut. Moving on to the ischium, we're going to have the ischial spine, which is right here. It's right under the greater sciatic notch. And then we have the lesser sciatic notch, which is this little rounded area right here. For the ischial tuberosity, it's actually going to be on the posterior side, which is this part right here. It's kind of like rugged. Moving on to the pubis, we have the pubic tubercle, which is right here. The pubic crest you actually can't see because it's going to be kind of the cartilage region of it. Then, however, for the superior pubic ramus, it's going to be this one right here, and then you have the inferior pubic ramus. So that kind of covers the whole coxa. Alright, so now we're going to talk about the differences between the coxa in male and in female. For male, it's actually going to be a little bit longer and narrower. However, for women, it's going to be broader and it's going to have a more of an oval shape overall. And that's kind of like the main differences in between the males and the females. Okay, so today we're going to go over the femur. We're going to start off with the fovea capitis, which is this little indentation right here at the head of the femur. The head of the femur would be considered this. The head of the femur is the surrounding part of it. After this, we have the greater trochanter, which you can see on the posterior side of it. It's this region right here. And then you have your lesser trochanter, which is this one right here. For the linea aspera, it's going to be this inferior region at the very bottom. Then you're going to have your medial and lateral condyles, which are these little parts right here. This is considered the medial condyle and then the lateral condyle. For the medial and lateral epicondyles, they're more on the superior side of it, which is over here. This one's going to be your lateral epicondyle and then your medial epicondyle. After this, we're going to have your intercondylar fossa, which is right here between your condyles. And then you're going to have your patellar surface, which is actually on your anterior side, and it's considered this part right here. After that, we're going to move on to the gluteal tuberosity, which is actually on the posterior side as well, and it's this little rugged line as right here. After this, you have the intertrochanteric line, which is on the anterior side, and it's this one right here. Then we have the intertrochanteric crest, which is this region right here. Okay, so now we're going to go over the patella. We have the base of the patella, which is the superior region, and then we have the apex of the patella, which is the inferior region of it. And you're actually able to tell that this is the left patella, because if you put it on a flat surface, it's actually going to lean more to the left than the right. So you can see how it's all standing up from the right side, it's leaning more on the left. However, when we turn it around, we're going to have the medial facet, and then we're going to have the lateral facet. The medial facet is a little bit bigger than the lateral side. And that sums up our patella. Okay, so now we're going to go over the tibia. You're going to have your medial and lateral condyles. Your medial condyle is considered this part right here. As far as your lateral condyle, it's considered this part right here. At the very top, you're actually going to have an intercondylar eminence, which is this part right here. Let's try and zoom in a little bit. It's right there. Moving on, we have the tibial tuberosity, which is at the very anterior end. It's right here. Then we have the medial malleolus, which is at the inferior end, and it's this region right here. Moving on, we have the fibular notch, which is on the lateral side, and it's this region right here. And that sums up our tibia. Okay, now we're going to go over the two main parts of the fibula. which is the head of the fibula, this superior part. At the very end, we're gonna have the lateral malleolus, which is considered this part right here. This one right here, so we have to flip it, it'd be the pointy end. And that sums up our fibula. Okay, so now we're gonna go over the foot. We're gonna start off with the calcaneus, which is the biggest bone of the foot, the talus, and then we have the navicular right here. We have the medial cuneiform, intermediate cuneiform, lateral cuneiform, and then the cuboid. And that sums up our tarsals, where we're going to move on to the metatarsals, which actually range from go from medial to lateral side. So you're going to start off with 1, 2, 3, 4, and 5. Moving on to the phalanges, the big toe or the hallux actually only has a proximal and a distal. However, the rest of the phalanges have a proximal, a middle, and a distal. And these also range from middle to lateral, so it would be 1, 2, 3, 4, and 5. And the same goes for the distal phalanges. And that sums up our foot.